So we are seeing a huge surge in the number of cases, and this has really gone up exponentially, causing a huge strain on the healthcare system. I think the cause for this is actually multifactorial, but I think the two main causes that one is that in January and February, when the vaccine started being used and cases came down, a lot of people felt that COVID is over and felt that they did not need to have COVID appropriate behavior. People stopped wearing masks, people started having parties, and there was a lot of get togethers and marriage functions because of the fact that all of them had been put on hold for a long time, for almost a year. Now, the virus was still around, and therefore, this gave an opportunity for the virus to spread itself rapidly. I also feel that at that point in time, unfortunately for us, the virus did mutate. A new strain was there in India, which was more infectious. It was able to spread more rapidly among people than what it was doing 6, 7 months ago. So therefore, this led to an environment which was very conducive for the virus to spread because there was no COVID appropriate behavior. The virus could spread rapidly in our community in special areas like we saw in Maharashtra and certain states to a large number of people because of crowding. And this led to a huge surge which happened in a very short span of time. The curve is very steep, suggesting that these two factors led to a huge increase in the number of cases in a very few days rather than weeks or months that we had seen last time.
Right, sir. So nationally, we're seeing record-breaking numbers coming in. So how do you think India should buckle up to combat this virus?
So currently, not only are we seeing record-breaking numbers, we're seeing a huge strain in the healthcare system because of if you even say that only 15% of people will require hospital care, if you have 2 or 3 lakh people per day, then the number of people who require hospital care proportionally goes up. And also, if one person is admitted in a hospital, he's going to be there for 5, 7, 10 days. So your hospital bed gets blocked. And if you continue to have more and more people coming in, you will run out of hospital beds. Therefore, I think we have to have a multi-pronged attack. We have to keep increasing our hospital beds and resources for the increasing number of cases that we're seeing. But we also need to work aggressively on decreasing the number of cases because no health system will be able to manage so many patients. And we will have a huge crisis in terms of patient management. And doctors already are sort of overburdened. They've been working for more than a year and other healthcare workers. So this is something that we need to really think about, that we have to urgently bring down the number of cases. And therefore, we must work aggressively on trying to see how we can bring down the number of cases, either develop containment zones, containment areas where your positivity rate is high. You do a lot of testing, tracking, treating, and isolation. You don't allow people from that area to go out and spread the disease, and therefore go back to all the strategies that we were following 6, 7 months ago to decrease the number of cases. The third thing that we need to do is aggressively ask people who are on the priority list to come forward and get themselves vaccinated so that will also help in decreasing the chance of transmission from one individual to the other. But I think the most important thing is that we have to work on decreasing our cases. This virus spreads very rapidly. Therefore, any crowding event, indoor and outdoor, will lead to a huge number of people getting infected there, even if 1 or 2 people who are asymptomatic are infectious.
Right, sir. So as far as huge crowds are concerned, so I would like to ask you that in the present scenario, when we have like a steep curve of COVID-19, what is your view on religious congregation and election campaigns that are happening across the country in terms of COVID protocols and everything?
So I can understand that we have a lot of, let's say, religious functions going on. This is the time when a lot of religious activities do happen in our country. And we also have the elections going on. But we must also understand that lives are also important. And therefore, we should have good COVID appropriate behavior. We can do this in a restricted manner so that the religious sentiment is also not hurt and other things can also happen. But aggressive COVID appropriate behavior is also maintained. We have to find a balance between the two things. If we don't have a balance, then we will have more and more cases coming up. Therefore, unless we're able to make sure that we are able to have the religious sentiments are also looked after, but at the same time, we make sure that it's done in a sort of a smaller manner or in a restricted manner so that it does not become a super spreading event. That is very, very important. Otherwise, the cases will continue to increase over the next few weeks, and we will have a huge issue in terms of the healthcare system.
Right, sir. So my next question would be that people are getting the virus even after the vaccination. So why is that happening, and what is the efficacy of the vaccine?
So when we look at efficacy, the efficacy of vaccines has varied from about 70 to 80% in most of the phase 3 trial for the Covishield vaccine and for Covaxin. It may be higher when you come to field studies. But I think it's important to remember two or three things. One is that any vaccine is not 100%, even the vaccines available outside. So you will have a small percentage of people who may still get the infection despite being vaccinated. Secondly, we must understand what are we wanting as far as the vaccine is concerned. We are wanting vaccines to save lives. So the vaccine will prevent people from getting severe disease. It will prevent you from getting disease which could kill you, which will make you go into the ICU, or which would damage your lungs. But it will not prevent you to a large extent. It may do to some extent, but not to a large extent, from getting the infection. So you have to understand the difference between infection and disease. You may get the infection, the virus may be there in your nose and throat, and you may be able to spread it to others. But the antibodies in your blood, which have occurred because of the vaccine, will not allow the virus to multiply for a long time and will not allow you to get a severe disease. But the virus may still stay for a short duration in your nose and throat, and you may therefore become RT-PCR positive. You may also give the disease to others. So you may get less disease, you may get a mild disease, or you may be asymptomatic, but you will not have severe disease. So the vaccine prevents you from getting more severe disease. It does not prevent you from infection totally.
All right, sir. My next question is that you rightly pointed out that the beds are filling up and there's a strain on the healthcare workers. So looking at the current scenario, how long do you think the second wave will continue?
So this is a difficult question, and I think it depends on how aggressively we move towards controlling this wave. If we all aggressively follow COVID appropriate behavior, we don't allow crowds to happen, we don't allow the virus to spread, the cases will come down and the peak will be much shorter and will occur much earlier. But if we don't do any of this, then remember we still have, as per the last Zero survey, almost 80% of our population which is susceptible. And therefore the virus will then start infecting everyone, and we will continue to have a scenario where things will get even worse over the next few days or weeks. So therefore, for us to bring this curve down and to decrease our mortality and decrease the strain on the healthcare system, the entire community, every citizen, every person in India should realize his responsibility. And I think I would appeal from the point of view of healthcare workers. The strain that the healthcare workers are undergoing in the hospital is very much because they've been working for 1 year, and now they're seeing this huge surge of cases where they're running out of beds. All of us are desperately trying to save lives, but we have to work on the other end of the spectrum also, that we have to decrease the number of cases. Therefore, it's every citizen's responsibility that he should have COVID appropriate behavior. He or she should avoid creating crowds and avoid allowing the virus to spread, because if the cases increase, the healthcare system will have a lot of burden which they may have difficulty in managing.
All right, sir. So my next question is that which out of the two strains
avoid creating crowds and avoid allowing the virus to spread, because if the cases increase, the healthcare system will have a lot of burden which they may have difficulty in managing.
All right, sir. So my next question is that which out of the two strain is more infectious? Is it the UK strain or the Brazilian strain?
So currently the data that we have in India is not that robust. We are still having data which is looking at it, because you may pick up a strain, but then you have to see how is the strain behaving in your community in terms of clinico-epidemiological profile. Is it spreading much more? Is it causing more severe disease? Is it causing reinfection? Is it decreasing the efficacy of the vaccine? That data needs to be collated. But whatever data we have from UK suggests that the UK strain is more infectious, is spreading more rapidly. There is some data from Brazil which also suggests that that strain also spreads more rapidly. We need to have data from our own country, because we also have a double mutant which is also there in certain parts of our country. So how are they behaving in terms of the spread of disease, in terms of other factors, is something that we need to urgently get some data on.
So about the vaccine, I want to point out that we have also registered for Sputnik 5, Russia's vaccine, and we have got the emergency use authorization for the same. So how beneficial do you think it will prove?
This will be very beneficial. I would say that two or three things that have happened over the last few days or weeks have been very, very positive. One is that the Sputnik vaccine has been now given emergency use authorization and it should be available in our country. So that will increase the pool of vaccines. Secondly, the government has allowed import of vaccines on emergency use authorization if they have already got emergency use authorization from countries like UK, US, European Union, Japan, or the WHO. So vaccines from outside can immediately come here and they can even start their manufacturing here without having to go through a bridging trial. And thirdly, a lot of manufacturers in India are now who can manufacture vaccines are tying up with the Indian manufacturers to increase the domestic production of the two vaccines which we are already making in India. So if all of this happens, then we will be able to dramatically increase our vaccine pool and therefore quickly be able to vaccinate more and more people.
All right, sir. My next question is, what is your take on the current vaccination drive being voluntary?
So the vaccination drive is currently voluntary, not only in India, but globally, because this is something that is an individual's right. Although I would say that in my opinion, as far as healthcare workers are concerned, we should encourage them and try and make it almost semi-mandatory that all healthcare workers should be vaccinated, not only to protect themselves, but to protect their patients also. Because if you get COVID and you are asymptomatic, but you are infectious, then you can give the disease to your patients. And if you're working in an ICU or working in a transplant unit, you're working in a cancer ward where you have patients on chemotherapy and their immunity is low, if they get COVID from you, then they will have a very bad outcome. Therefore, for the protection of your patients, all healthcare workers, especially those working in hospital areas or looking after sick patients, should get themselves vaccinated. And I feel this should be more or less mandatory.
Okay, sir. So India's workforce is majorly below 45 years of age. So what do you think, that do we need to lift that age bar? I mean, when it comes to vaccines?
So once we have been able to vaccinate those who are at a higher risk of having more severe disease, that is the elderly, those who have comorbidities, we should gradually lift or lower the age bar so that more and more people come into the pool of people who can be vaccinated. And I think that will happen in the coming few weeks because as we've just discussed, we will have more and more vaccines which will come into the common pool. And therefore that will allow us to really open up the vaccination to a larger amount of our population.
All right, sir. So my last question to you is that is Delhi going in the right direction as far as COVID restrictions are concerned?
So again, we have to look back at what we did 6-7 months ago when we had the spike in Delhi. We have now a larger spike than that time. And at that point in time, aggressively things were done in terms of testing, tracking, treating and isolation. A lot of containment zones were made so that there was almost like a mini lockdown in those areas. We need to start looking at the same strategy there. If we have areas where there is infectivity is large, if there's a large number of people who are infected in that area, that colony, that area should go under lockdown. We must not allow people from there to go out and spread the disease to other areas. Everyone in that area should be tested, tracked. All the close contacts should be tracked. They should be isolated or quarantined. And we should aggressively work in bringing the number of cases down. Because currently we are seeing a huge surge in Delhi. And unless we work aggressively, it will continue to rise. Therefore, I think the strategies and the lessons that we learned 6-7 months ago need to be aggressively followed. Now we've become a little lax because we felt COVID had sort of gone away. And therefore, both in terms of health infrastructure and in terms of the containment that we were doing in the past, we need to redo that again.
All right, sir. All right. I think that's all for the interview, and thanks a lot for joining in.
Thank you very much.
Thank you for this.
नमस्कार, मैं हूं मानक गुप्ता। अगर आपको हमारा ये वीडियो पसंद आया हो तो इसे लाइक और शेयर जरूर करें और हां, हमें सब्सक्राइब और फॉलो करना ना भूलें ताकि आप देश और दुनिया की कोई खबर मिस ना करें। तो जुड़े रहिए हमारे साथ और देखते रहिए न्यूज़ 24।